Hi folks, this is Tony for aminutetomidnight.com with a very short video update. It includes clips from today's White House coronavirus briefing and some other short clips, including one from the UK also from today. It should leave you in no doubt that the agenda is to push vaccines, and Donald Trump is very much a part of that as well.
I have confidence that our public health response of early case recognition that we've talked about, isolation and contact tracing, combined with our plans for increased surveillance, particularly for the most vulnerable, will be an effective public health strategy so our nation will be able to maintain itself in the containment mode. And again, that will be supported by the American public's continued cooperation, obviously in the areas of personal hygiene and the types of social distancing strategies that may be appropriate. The key to my comments, and the reason that I really wanted to stress them, was to appeal to the American public to embrace the flu vaccine with confidence. One of the greatest tools we have as we go through the fall, winter season that we're into is to get the American public to embrace the influenza vaccine and thereby minimize the impact of flu to be the co-respiratory disease that we confront. Thank you very much.
And his whole purpose in making the statement was to get a flu shot so that next fall we don't have such a big season of flu, and we possibly won't. But as you said, it's possible if the corona even comes back, and he doesn't know that it's going to, and neither do I. We spoke at great length, and I think the doctor will speak if you'd like to continue, but we may have some embers, and we're going to put them out, of corona, but we may have a big flu season. But that's different. Flu is very different from corona.
Dr. Redfield, the Washington Post, which you did the interview with them, they quoted you as saying there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through.
This spring that we just went through, February, we had a benefit of having the flu season ended. So we could use all our flu surveillance systems to say, whoops, this is coronavirus, we need to focus. Next fall and winter, we are going to have two viruses circulating, and we're going to have to distinguish between which is flu and which is the coronavirus. And so the comment that I made, it's more difficult. Doesn't mean it's going to be more impossible. Doesn't mean it's going to be more, as some people have said, worse. It just means it's more difficult because we have to distinguish between the two. And what I was wanting to do, and what I want to do again here, is appeal to the American public to recognize they can really help like they did with mitigation, which they really helped. I need them to help now to best prepare us by getting the flu vaccine and taking flu out of the picture. I think the American public is going to heed the request to relook at their vaccine hesitancy to vaccine with confidence for flu. And I'm confident that the public health infrastructure that we're putting together now across this country so that we can early case diagnose, isolate, and contact trace, as I say, block and tackle, that system is going to be there, and we're going to be able to contain this virus.
I think what Dr. Redfield clearly was asking for, just like we ask for every American to follow the guidelines, he's saying please add to that guidelines getting your flu shot. That we're hoping that the flu infections also go down because people are much more aware of respiratory illnesses and how to protect themselves. We want you to get your vaccine, but we also want to protect individuals from getting the flu because of the vulnerability we know in certain populations to flu and the devastating outcomes to flu. We could prevent and decrease both of those things. So I think we are assured that the CDC is putting in place today what we are going to need in the fall so that we can stay in containment if potentially the virus comes back.
And approved $8 billion, including money for the development of treatments and vaccines, and we're doing tremendous work on both fronts. The vaccines are coming along very quickly.
In the long run, the best way to defeat coronavirus is through a vaccine. After all, this is a new disease. This is uncertain science, but I'm certain that we will throw everything we've got at developing a vaccine. The UK is at the forefront of the global effort. We've put more money than any other country into the global search for a vaccine. And for all the efforts around the world, 2 of the leading vaccine developments are taking place here at home at Oxford and Imperial. Both of these promising projects are making rapid progress, and I've told the scientists leading them that we'll do everything in our power to support. First, I'm today making £22.5 million available to the Imperial project to support their phase 2 clinical trials, which are going to assess a sample of several thousand, and for them to begin the work on subsequently a very large phase 3 trial. Second, I'm today making available £20 million to the Oxford team to fund their clinical trials. The team have accelerated that trials process, working with the regulator, the MHRA, who have been absolutely brilliant. And as a result, I can announce that the vaccine from the Oxford project will be trialled in people from this Thursday. In normal times, reaching this stage would take years, and I'm very proud of the work taken so far. Vaccine development is a process of trial and error and trial again. That's the nature of how vaccines are developed. But I've told Sarah Gilbert and Robin Shattuck, 2 of our most inspiring scientists, that we are going to back them to the hilt and give them every resource that they need to get the best possible chance of success as soon as possible.
Earlier this week, the first clinical trial of the vaccine candidate for the virus began in Washington State, as you probably know. The genetic sequence of the virus was first published in January, but thanks to the unprecedented partnership between the FDA, NIH, and the private sector, we've reached human trials for the vaccine just 8 weeks later. That's a record by many, many months. It used to take years to do this, and now we did it just in a very short while. That's the fastest development in history of what we're doing with regard to the vaccine. We're making very, very big progress.
We should be able to make vaccines in more like a year than a year and a half. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%. If we have success on it. And the benefits there in terms of reducing sickness, reducing the population growth, it really allows the society a chance to take care of itself. And the good news is that as you make those breakthroughs, the population growth in the country goes down.
That I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations. I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak.
As the world scrambled to manage the outbreak, the question many have been asking is, when will a vaccine be ready? Donald Trump, himself once a critic of vaccine standards, met with leading US pharmaceutical companies as part of his early response to see what could be done to fast-track the development of a vaccine for coronavirus. In the meeting, he floated the idea of getting a vaccine to the public by November 2020, 8 months from the meeting. Experts in the room were quick to correct expectations. That timeline was simply unrealistic. But the urgency Donald Trump expressed certainly wasn't.
And give us some time to get both the drugs and advance the vaccine. It is fair to say things won't go back to truly normal until we have a vaccine that we've gotten out to basically the entire world.
Folks, we're being fast-tracked into a world where vaccination will be mandatory. You need to decide now how you will deal with that situation.